the Master of Medical Imaging Science. So thanks a lot for coming along and joining into tonight's webinar. What I'd like to do is just a bit of housekeeping while we wait for some more people to come online and join us. So you might see with your particular interface the ability to raise your hand. So I just want to check that my microphone is working okay. So can you have a look and see if there's a little button there that allows you to raise your hand, and just tell me if my voice is coming across nice and clear. Okay, okay, I can see some hands going up. Thank you very much. That's good feedback. It's good to know it's working. Great, so just going to give a couple more minutes for people to log on. And while we're doing that, I'll keep talking, and I'll have a look at a few of the names there. You might find that I'll repeat myself a couple of times because I just want to give the information to the new people who come and join us for tonight's webinar. So I can see some names there: Alexandra, Alicia, Annalise. I can see Cindy and Dennis. Howard, Josephine, Nicole, Olawale. Apologies for my poor pronunciation. Stephen, Than, and Tryon. Great. So I've looked at earlier this evening, I looked at a lot of the registrations. I can see that a lot of the names are very new to me, meaning that they're people who aren't existing students. I know there are a couple of existing students that are coming along to hear a little bit about credits and some other information that we'll talk about in this evening's webinar. So you might notice on the various tools available on the webinar, and I'm looking to the side a little bit because I've got a copy of what you see over on my iPad over on the left-hand side. But one of the things that you can do is to post some questions. So have a look through your toolkit, because I will be taking some time to answer questions throughout the webinar. There is a chat facility as well, but I'd ask you not to use the chat facility. I'm just going to be using that tonight to talk to a colleague of mine who's assisting in the webinar while we're online this evening. What I might ask someone to do is just to have a look around on the tools that you have there and see if you can find out how to ask a question. And I'll ask one of you just to post a question, maybe something you'd like me to cover during this evening's presentation. And I'll review those near the end, and my colleague will also help me with that, and we'll go through and answer some questions that you may have about the program. So if one of you could try and find that tool to allow you to ask some questions, and pop a question up there so we can just see if that aspect of the webinar is working the way that we anticipate. There we go. Thanks, Tran. I can see that you put a testing question up there, so it looks like you've sorted through the technology. Thanks for posting that up. So anytime during the webinar while I'm talking, feel free to put questions up. I probably won't get a chance till near the end to review through the questions, but just as things come to mind, feel free to put your questions there, and we'll try and get through those and answer them as best as we can. So it's almost 5 past, and so I'll probably start in the next minute or so for tonight's webinar. So while we're waiting, why don't you think about reasons or the sort of things that you'd like to get from tonight's webinar and put those up as questions, and that will give me an idea of the sort of things that you're looking out for. Okay, let's have a look, see if we've got any new questions are there. Right, so one of the questions coming up already, as a graduated and fully qualified radiographer, how will this course add to my education and professional development? Okay, so I will get back to that question. Thank you for that. That's a great question. Thanks for posting that, Annalise. I appreciate that. So it's, according to my clock, it's 5 past the hour. So I am going to start the webinar this evening. And during the webinar, I'll turn off my camera. We'll just focus on the slides, and I'll talk through the various things that I'd like to cover. Please keep those questions coming in. They'll really be useful for me wrapping up the discussion and trying to ensure that as much of the information that you wanted to get from this webinar has been covered. So I'll just turn off my camera for the time being, and we'll start the presentation. So the Medical Imaging Science program is a postgraduate coursework program that can be done as a distance education program, and I call it a medical. You can also enter the program in different levels, so you can come in and do a graduate certificate, you can do a graduate diploma, or you can do a master's. And we'll talk about the structure of each of those various ways of entering the program a little later on in the presentation. One of the things that I think is a real advantage of this particular program is it is so flexible. But when you add flexibility to the program, it also adds a level of complexity. So I want to try and take some time to explain that complexity to you so that you know how to navigate your way around the program. So, for example, some of our students can come in and start as in the graduate certificate of medical imaging science, enjoy their experience, and then articulate into the graduate diploma or into the master's. Or someone doing the master's program, if they had to leave the program early, was unable to finish the master's, they could change their enrolment down to a graduate diploma, for example, and exit at that point. So there's different ways you can enter and different times that you can exit the program. So once again, it gives us lots of flexibility in the way that we do things within the program. One of the things that is nice about the program is that if you do a certain set of subjects, you can leave the program with a specialization. The specializations that we offer are computer tomography, magnetic resonance imaging, radiographic image interpretation, hybrid imaging, breast imaging, and if you're doing the masters, you can focus on research, on a research topic. And I'll talk about the subjects that you need to do to complete those specializations. And they're available for students who are enrolled in the graduate diploma and in the master's program. Unfortunately, if you're enrolled in the graduate certificate, whilst you can do some of the subjects required for that, with the core subject that's required, you're unable to get sufficient subjects to complete a specialization. So the typical applicants for our program are those who have completed a medical radiation science program. You might have done an undergraduate degree as a diagnostic radiographer, a nuclear medicine technologist or scientist, or a radiation therapist. We also have applicants who have completed a graduate entry masters, like we have at Sydney University. You can come into our program as well. So that is most of the students that come into the program. We do occasionally get someone who's done a medical degree, who's interested in learning some aspect of CT or radiography, who might be interested to pick up some of the subjects. But I'd say 90 to 95% of our students are students who have done an MRS program. So when we put the program together, these are the aims, these are the things that we're trying to identify. We want to develop graduates who are capable of identifying and creating evidence for evidence-based and best practice. So these are the skills that we're trying to instill in our graduates, and we do that through our core subjects as well as through our specialization elective subjects. When we designed the program, you may be aware that we've offered a graduate program since the late 70s. It was the Master of Health Science MRS. But when we redesigned this new program, the Master of Medical Imaging Science, we thought about what are the research strengths of our academic staff, and can we align the teaching with those research strengths? So we've really had the experts, the international researchers, teaching into our program and guiding the learning. So we thought about that very carefully when we designed the program. And the other thing that's required through the Australian qualifications framework, and one of the requirements as part of Sydney University is that for our master's students we provide a capstone experience, and I'll talk about how we've designed that capstone experience for our master's students a little later on in the presentation. So what I'd like to do is take you through each of the various specialisations that we offer and just give you a bit of a summary of those specialisations, and a little bit later we can talk about the sorts of units of study that go into the specialisations. So many people have finished their undergraduate degree or the postgraduate degree and now are working a lot of their time in their profession in computer tomography or magnetic resonance imaging, and they'd like to get additional knowledge and skills in that particular area. So we've designed these specialisations to suit that particular need. And the typical structure of a specialisation is that you're required to complete 4 units of study. Now at Sydney University, each of those units of study are 6 credit points, so these add up obviously to 24 credit points. And these are the subjects that can be used for a specialisation. But in saying that, a subject can only be used for one specialisation, so it doesn't go across multiple specialisations. So there have to be 4 unique subjects in our master's program for the specialisation that you're trying to achieve. I digress a little bit, but students who do the master's program, and that involves 72 credit points or 12 units of study, they can graduate with 2 specialisations. So, and you need that number of credit points to do that with a combination of specialisation units of study and the combination of the core units of study, which I'll go through as well. But just be mindful that someone doing a graduate diploma, for example, has enough, at 48 credit points, is enough to do 1 specialisation. But if you're doing a master's, there's the capacity to do 2 specialisations during the study. And I'll talk about how the unit study might be structured and look in that type of enrolment. Okay, so I'm just going to go through the various specialisations briefly and just give you a bit of an overview of some of the things that we're trying to cover. So the first is computer tomography specialisation. We're very with the computer tomography specialisation and the MR specialisation, we have a theory subject that you start with. So you start off with CT theory, and we go through all the science and the fundamentals behind the CT instrumentation and image formation and radiation dose minimisation. Then we have subjects like computer tomography A and B, and this is where we go through the sort of protocols that you typically do. The use of contrast, for example, during CT, and we talk about all the parameters that you can alter and how you go about getting the best possible images out of the CT acquisition. And we think about, well, if you've got a patient who presents in a particular way, how would we modify those protocols to be specific for that patient to get the best possible results? We also talk about interventional procedures and protocols that investigate motion, and that becomes more towards the computer tomography B subject, which would be done typically in the 2nd year of part-time enrolment. So the next specialisation is the magnetic resonance imaging specialisation. So we go once again through the fundamentals and the principles of how MR works and things that relate to safe ways of performing MR. As you know, MR isn't we're not so concerned with the radiation when we're doing MR, but we have to be very concerned about and very careful about the strong magnetic fields that the patients are placed in and the sort of equipment that we can bring into the scanning room that could potentially become projectiles. So we have to think very carefully about the safety issues when performing MR. We focus on MR applications to the CNS and the musculoskeletal regions. So we go through all the various applications, the various sequences, and the ways that we go about generating those MR images. We also talk about more specialised techniques, with ensuring that you have a theoretical understanding of things like functional, contrast, and angiographic imaging. And we support all this with clinical cases. And for the MR theory and for the CT theory, we also have the ability to log online and use actual equipment. In the case of CT, we have a CT scanner that you can access remotely and perform tutorials on all at home using your computer system through the internet. And the same applies for the MR. The MR obviously is not a full human system, but it's a basic system that runs on the Earth's magnetic field, but we can still talk about pulses and sequences and learn some of those fundamental principles using these remote access systems. And this is something that's really unique to this program, is that we have that type of online technology to support students learning at a distance. And I will give you a demonstration of that closer to the end. So the next specialisation I want to talk about is the radiographic image interpretation. And one of the things I can talk about, or should have mentioned beforehand, is that we have some great staff who are experts in these areas, teaching and leading these specialisations. So for the radiographic image interpretation, we have Stephen Littlefair. He's from the UK. He's been trained as a radiographer who reads, and he teaches to undergraduates as well as leads the three important electives, radiographic image interpretation A, B and C, and takes students through all the important aspects of what what we're looking in plain X-rays, normal appearances, various pathologies, and has some wonderful tutorials and assessments that guide you through evaluating plain radiographs and coming up with an understanding of the various appearances of pathology seen in that. So Steve Littlefair at the moment is doing a PhD. He's probably about 2/3 into it, and he is. This is the area that he's researching in. This is the topic of his PhD. So he's a real expert in UK training. We're very fortunate to have him on the team. So the next topic is hybrid specialisation, and this would be of most interest to those who are nuclear medicine technologists, scientists who are doing the program, and taking you through subjects that talk about PET-CT and SPECT-CT, as well as a new modality that's come into Australia and internationally, PET-MR. So we have hybrid imaging A and hybrid imaging B that cover those. And then we also allow students to do the CT theory or the MR theory to sort of complement that particular modality. So this is, as far as SPECT-CT and PET-CT, not new in the sense that it's been around for at least a decade, but becoming a large part of what performing nuclear medicine is. So one of the things that we'll look at is what factors influence image quality, look at radiation dose optimization. We're fortunate that we've got people teaching to the program like Associate Professor Roger Fulton from Westmead. He's a medical physicist from Westmead Hospital. We've also got Professor Dale Bailey from Royal North Shore, one of the first people in Australia to put together his own PET-CT system that was used clinically within Australia. So we have some real leaders in this field involved in the development of the learning experience and the teaching. And myself, my background's a nuclear medicine technologist who has done a PhD, and this is an area of interest and research for me as well. So we're all teaching into this, and I'm leading the hybrid imaging specialisation for this particular course. So we look at different imaging protocols, when they're appropriate, when it's best to use those type of protocols. And the great thing in nuclear medicine is that there's lots of new things happening with radiopharmaceutical development. So there's new techniques coming online that these hybrid imaging can be applied to, and great advances in the technology that we're currently using. So the next specialisation I want to talk about is breast imaging, and breast imaging really matches well with the research strength within the discipline. So we've got an international world leader in the area with Professor Patrick Brennan, but there's a whole team of associate professors like Dr. Sarah Lewis and Dr. Mark McEntee, Associate Professor Claudia Mellon-Toms, all teaching and all involved in this particular discipline. So we see this as a real research strength within our discipline, and we're really excited and proud to be offering this breast imaging specialisation. And so, we really do have some leaders in the field involved in the delivery of this particular specialisation. Some people might come to the program and say that I'd like to do research in my particular profession, but I'm not necessarily ready to launch into a master's or a PhD. I need something, I'm looking for something that's a little bit more structured in its design, and a sort of a process or a coursework that's going to help me develop and implement my research project. So we have the ability for people to do research studies as a specialisation, and we have a number of faculty electives about research design and implementation and dissemination and ethics and so forth that students can enrol in. And the nice thing about that program is if you complete it, then you would have completed enough research component to then go on and apply for direct entry into a PhD, or if you choose to apply for entry into a master's, you can do that as well. And you'd be eligible to apply for an Australian University Postgraduate Award, which is some financial assistance that we offer people doing PhDs to help them get through the program so that they can study full time. So I just want to now take a moment and start talking about how the course is actually structured and go through the various ways that it's put together. I'm just going to mute the microphone for a moment just while I have a glass of water. It won't be a sec. So this is a nice slide here in that it really tries to give you an overview of the whole program and how it can be laid out. Don't be too concerned about the order of the subjects. Things can be moved around in different ways, but what we really encourage students to do is the current concepts, core unit of study up front, and we require you to do the capstone subject at the very end. So they're the bookends, I guess, of the program. Let's look initially at the entry pathway. So most of the students that come into our program will have completed an undergraduate bachelor's degree, or they may have done a postgraduate degree. It could be a grad cert, a grad dip, or a GEM type program. If you're coming in with an undergraduate degree, what we ask for you to do is what we require for you to come directly into the masters is to have a credit average on your transcript. If that's not your situation, that's fine. You can come into the graduate diploma program, and after you've completed a semester completed a year of that program, you can apply to go into the masters at that point. Or another way you could do it is to successfully complete the requirements of might be a better way actually, to complete the requirements of the graduate certificate. Once you've successfully completed the requirements of the graduate certificate, then you can enrol into the master's program. So it's not a barrier, but for direct entry, that's what we require. If you're coming to us from a GEM program, or you've completed a graduate certificate or a graduate diploma, once again, you can go straight into the master's program. So you can see that I've grouped these into 3 groups of 4, and each of the 3 groups represents what's required for the exit. So the first group would be typically if you were doing a graduate certificate, these are the 24 credit points that you'd be required to do. If you're doing a graduate diploma, there are 48 credit points, and if you're doing a master's, there are 72 credit points. So you can see the various bands and the points that you can exit from the program. There is things like recognition of prior learning that you would have read about in the brochure. I will talk about that. That can shorten the length of your study. And you can apply it for up to 24 credit points, and that means that you might complete the Masters in 48 over 2 years part-time, 48 credit points, instead of studying 72. But I'll get to that in the future. But I just thought I'd give you the heads up as to that's one of the things that we can discuss. And the course structure that I've displayed here, this typical course structure, is for a part-time enrolment. So normally people enroll part-time, do 2 subjects a semester, and so in 1 year they would have covered points. And I highly recommend that for people who are working full-time to enroll in a part-time mode. My academic advice is that it would be incredibly fine to enroll full-time into the course and be working full-time. So that would require that you need to do in a semester, and that's what our full-time undergraduates are doing and our full-time GEM students are doing. I personally believe it's way too much to do for those who are working at the moment. And most of our applicants and students are working full-time as they're doing this program. So the course subjects are listed. So you can see here if you're doing the graduate certificate, you need to do current concepts in medical imaging as a course subject. If you're doing the graduate diploma, you can see that there's now 3 course subjects that include medical imaging perception, medical imaging optimization, and if you're doing the masters, you can now also see that there's 4 medical imaging science capstone. Okay, so over the left-hand side, sorry, on the right-hand side in purple, we've got the elective units of study, and you can see we've got the subjects that are particularly referenced to those electives listed. For example, you've got computer tomography, there's theory, there's A and B, magnetic resonance, there's theory A, B and C, hybrid imaging, there's A, B. And a little later on I'll talk about what makes up the specializations. Also, there's some research elective subjects that you can do as well, particularly for those doing a research specialization. Okay, let's have a look at some examples. So what I wanted to show you here is what it would look like if you came in and did the master's program and you wanted to complete a CT and an MRI specialization. What would the enrollment pattern look like? How would you go about laying out your enrollment over the 3 years part-time that would be required to complete those specializations? So you can see that in the first year, you could start with your first semester current concepts in medical imaging, and then you'd get into the computer tomography theory. Medical imaging optimization in the second semester, then computer tomography A, and then first semester you do computer tomography B. In first semester of the second year, you'd start then doing your magnetic resonance theory. So you'd start, there's a bit of an overlap between the 2 specializations. So you're kind of finishing your study in the computer tomography in that semester, but you're also starting your study in the magnetic resonance. Now, to complete the specialization in the computer tomography, you need to do the directed studies A subject, which is a project-based subject where you'll do a particular investigation wrapped around what you've learnt in the computer tomography theory and A and B subjects. So then you keep moving down, you come to magnetic resonance A, another core subject, Year 3 semester, magnetic resonance B. I've left the C off the second semester subject. That should be magnetic resonance C. And at the very end, you do your capstone experience or unit of study, which pulls together all that learning that's gone beforehand. Typical enrollment. Actually, I'm going to talk about credit in this particular slide. So there's a couple of rules about credit, and there's different types of credit that I want to tell you about. There's specific credit, and there's unspecific or non-specific credit, recognition of prior learning, and there's also a thing called a waiver, which I'll take you through. So there's a couple of rules that apply. You can apply for credit, specific credit for units of study that you've completed. These cannot form part of a completed undergraduate or postgraduate program. If you're coming from another institution, two-thirds of the course must be completed at Sydney University, and the maximum amount of credit we can give in a course is 50%. So these are the sort of rules that outline the way that credit works. So a scenario would be here that someone comes from another university, they've been started a postgraduate program, they haven't actually completed the program, but they've decided they want to transfer across to our master's program or one of our medical imaging science program, and they present to me a unit of study that they completed in at the other university, and they're asking whether the learning aims and objectives are very similar to a subject that we've offered. So that's an example of how specific credit applies. You take a unit of study that you completed in a program that you didn't complete, and you demonstrate that the learning objectives and the learning that occurred is covered in one of the units of study that we offer, and then we give you specific credit for that. So here's a scenario that sort of shows you what that might look like, and in this case, someone might have been in another institution, they've already covered the theory of computer tomography, so I give them specific credit for that, and that means in the program that's 6 credit points that they don't have to study, and that's 6 credit points that they don't have to pay for. So that's an example of how specific credit would work in that particular scenario. Okay, so now what I'd like to talk about is non-specific credit. And what I might do, my colleagues just sent me a reminder that I've noticed, is that what I might do is just, because I've been talking for a while, 30 minutes actually, what I might do is just do a little bit of a poll, a couple of poll questions, and so I'm going to launch these. These are just things about what you, you know, how you found out about this evening, the sort of things that, you know, you'd like to get from the program. If there was another webinar, what sort of content would you like us to cover? So they're the sort of things that we're going to cover in the poll. So let's launch one of these polls now. So we'll start with a really easy one. How did you find out about the webinar? And have a look on your screen. There should be the ability for you to select one of those and post it. Now I'm just looking at the number of people who have voted so far. I'm just going to wait till it gets pretty close to the 100%, and then I'm going to close that. So I can see that 67% received an email, and 33% heard from a colleague or a friend. So looks like there's no more submissions for that. Let's close the poll and let's have a look at the results. Okay, I thought it might have showed you the results there, but okay, let's see if I can share the results. I'm just following my screen here. Okay, so I spent a bit of time putting things out there with Twitter and Facebook. I can see that that's been a bit of a waste of time, but you know, what I'd be interested in, if you wanted to pop something in the questions, just to tell me where that email actually came from, where did the emailer actually originated from. I'd just be interested in seeing that. So I'll have a look at some of your responses to that. All right, and from colleagues and friends. So maybe a colleague or friend received an email from the university. Let's have a look at another poll question. So let's hide those results. Okay. So hopefully you'll see the next one. Which of the following best describes your interest in the Master of Medical Imaging Science? And we're getting more of a distribution with this response. So I think once again we're getting pretty close to as many responses as we're going to get. That's 74%. Okay, any last votes just to finish off? Okay, let's close that poll and share the results. Okay, so we've got people who've already applied and probably wanting to know about how the credit structure works and the various ways that the course is put together. We've got some people thinking of applying and that's 12%. So just remember that you've got to the 31st of January. It's an online application process. I can go through that a little bit more later on. But there's still time to get your applications in. Just remember that if you are thinking of applying, it's probably better to do it sooner than later because as you can imagine, there's going to be a lot of applications coming into our student system, our student application system, so we try to give them as much time to process those as possible. And we can see a lot of people are just genuinely interested to know a little bit about what the course is about. Great, so I'll jump back to my presentation and I've got a couple of poll questions that okay. Sorry for the pause. When I'm reading I'm from my colleague and other things, so I take a bit of a breather and a pause as well. Probably an indication of multitasking isn't going so well at this time of night. So let's talk about non-specific credit and recognition of prior learning. And this is of great interest to many of the people who wish to do the Masters or the Graduate Diploma, but particularly the Masters. I believe it works quite well with the Masters. What we do is that what you can do is apply for recognition of prior learning, and this can be up to 24 credit points of non-specific credit for recognition of prior learning. So that will reduce the Masters, which is 3 years part-time, this will reduce the Masters 3 years part-time to 2 years part-time. And the way that we can award recognition of prior learning is that if you come to us and you've completed an honours degree, if you've already completed a graduate entry Masters, or if you've been working for 12 months as a fully registered medical radiation practitioner, you're registered with APRA, you've got your accreditation, you provide a letter from your employer saying that is the situation, we can also give you recognition of prior learning for that as well. So that's how it works. Now, everyone is enrolled into the Masters for the full 72 credit points, but you don't have to apply for recognition of prior learning when you do your application, but during the program you can apply for the amount of recognition of prior learning. And sometimes students don't take all the available 24 credit points because they might want to be trying to complete multiple specializations, or they've got other credits that they've been eligible for. So it really depends on the individual. But most people are doing one specialisation, apply for 24 credit points and non-specific credit, and finish the program in 2 years part-time. Okay, so this is how the program would look if you successfully applied for recognition of prior learning. So you've got the 24 credit points available there, and you can see that now I've called year, that recognition of prior learning year, I guess, is year 0, and you can see how a course might now be structured over 2 years part-time. So this is someone entering into the Masters. You can also apply according to for recognition of prior learning for the graduate diploma, but be mindful that you won't be completing a specialisation, as there's a limited number of subjects that you can do because you're required to do the core subjects as well. So from memory, the graduate diploma, for example, has 3 core subjects and 1 elective, and if you've got all the 24 credit points of recognition of prior learning, it means you're going to spend most of your time doing the core subjects and only 1 elective, and that probably wouldn't fit many people's educational objectives. So it applies mostly for those people who are doing the Masters. And you can see now the way that I've put the program together, how you can complete your 4 elective subjects for your specialisation and your 4 core units of study that's required as part of the Masters. And I'm not in the requirements of current concepts in medical imaging. So what you can do is apply for a waiver. You're not actually, it's not a specific credit where you aren't required, now there's 6 credit points less that you're required to complete your program. You still need to complete the required number of credit points, but you can insert another subject in the place of that core units of study, current concepts in medical imaging. So it gives you the ability to choose another elective as opposed to doing that core unit of study, which is normally done in the first year of program. So a waiver is something that during the program. But by the end of the Masters or the end of your studies, you need either received a waiver or have completed that as a requirement. And I must say the waiver doesn't apply currently doesn't apply for those enrolled in the graduate certificate. We just consider it for the graduate diploma, and we consider it for the Masters program. So here's an example if you successfully applied for the waiver. So you can see now at the top where we previously had the core unit of study, the current concepts in medical imaging is now replaced with an elective in its place. And this is how the waiver would look with recognition of prior learning. Once again, we can see down here in year 1, there is an elective replacing that core unit of study imaging. So this is a place you can go to and get further information about the program. There's a URL that's available. If you type in the Master of Medical Imaging Science into it and say Master of Medical Imaging Science at Sydney University, through your favourite search engine, I'm sure you'll come up with a link as well, but this is the direct link that you can use. Emails to the team at our Student Central, at our particular Faculty of Health Sciences, and ask questions. They're very good at answering those questions, but if there's a tough question they're not sure about, they'll put your inquiry in through to me. And here's some telephone numbers you may wish to call as well as if you're looking for further information. Another good that you can go to is the Faculty Handbook. Has some very detailed information about the way that the course is structured. And once again, through your favourite search engine, you can type in Faculty University. Confident that will take you to a link that would point you in the right direction. So what I'd like to do is another poll, and then I'm going to show you what onto system, so the CT. So I'm going to go through that with you as a demonstration, but I want 5 or 10 minutes at the end to go through some questions. So what motivates you to pursue the postgraduate education in medical imaging science? Work in the field, and I wish to improve me, will help me with promotion. I'd like to be a mentor and a thought leader in this area, and I'd like to be the person who develops the evidence for best practice skills. Great, so let's have a look at the results. So most of the results are coming through, I work in the field and I wish to improve my understanding. Some of you would also like to go on and who can educate others within that particular specialisation that is in that area and become a thought leader in that particular. I think this is one of the things that we pride ourselves at Sydney University being able to do, and we're pretty confident that we can support you in that process. Let's have a look at another poll. Would you be interested in another webinar on one of the following topics? CT, MRI hybrid specializations, breast and radiographic image interpretation specialization, research specialization, or applying for credit? So the polls are coming in thick and fast. So I'm watching the clock as well. I'm mindful of the time, so I'd like to finish close to the hour, so I'll do my best to achieve that. Okay, let's have a look at the result. So it's pretty evenly split. CT and MRI hybrid specializations, applying for credit, great. And we've also got breast and radiographic image interpretation specialization. So I can go through and plan another webinar in the future that might touch on some of those particular topics, and we have your contact details, so we can certainly let you know when that webinar would be held. So I mentioned showing you one of the, excuse me just while I jump back, showing you one of the tools that we have available for remote teaching. So what I'm doing now is I'm taking you to program that's called LabChip, and I'll log on to the CT scanner. So what we're looking at here and is a CT scanner live based at the Faculty of Health Sciences at LabChip. And access the CT scanner and operate it remotely to run a whole series of experiments, practicals to facilitate your learning in the principles of performing a CT scan. We have controls over the various cameras, and you can see that I can zoom in camera and magnify what I'm looking at. I can use these other cameras that you can see within the image that's displayed to have a look at the position of the phantom that's on the bed. Number of different angles that we can do that. And I can also launch, I'll go back to where we were before in the operator's office. And I can also launch that computer you can see down on the left-hand side of the screen to the CT scanner. So it's just going through a So what it's bringing up is the control that whole CT unit through the and analysis computer that you normally use during this acquisition. I'm not going to operate it now. I think it's probably more important to get onto the questions, but there is the ability for us to move that bed in and out using the control system to and to acquire a CT of that particular scan while we're changing all the various parameters that we'd normally do during a CT procedure. So that is an important study. And we also have something that's available for MRI, not a human system, but another system that teaches those basic principles. So what I'll do now is I'll jump back to my slides and I'll have a look at some of these questions. And I might ask my colleague to help me identify some of the questions. Please feel free to put those up. Great, so there's a couple there. And I'm just going to see if this works. I might put my webcam back on. So the first one is from Annalise. Thanks for your question. As a graduated and fully qualified radiographer, how will this course add to my education and professional development? So I think most people coming to this course would have done their undergraduate or GEM program and be working a lot of their time in a particular specialization area. So they might be working and they want to go through the theory in depth, and they also want to learn in detail about the various protocols. And I mentioned about Steve Littlefair in the radiographic image interpretation. In the fields of Dr. Karen DeBelli, who works in Queensland, she's heading up the CT. We also have Dr. Elaine Ryan, who does the CT theory, a medical physicist. So I've got some really qualified researchers working in that area to teach those programs. So you will be mentored and learning from people who are really well qualified in those and leaders in that discipline. In magnetic resonance, we've got South Wales. They're both involved in the teaching and the delivery of the who are currently working, and researchers in the field of these learning programs, and the various applications. So what I enhanced learning, up-to-date knowledge about the actual specialisation in the area that you've chosen to work. So what is the study outcome of the radiographic image interpretation? This is a question from Joe for new graduates. The application study per semester, if you're willing to extend the program into the, you can reduce that down to less for short periods of time. You can take a leave of absence. So if you need to, it's a bit hard to enrol in the program and take a leave of absence for the first semester. They might say, well, why don't you come back and apply next year of tailoring programs. Some specific credit, sometimes someone mid-year might say, oh look, I just missed out on what can I do? And you might be able to do some subjects as postgraduate non-award subjects, and we can give you specific credit later on for those subjects into the program. So there's a couple of ways we can think about working around that issue, but ideally my academic advice is to apply at the start of the year, at the end of January. So there's a question here from Yan Lee. He's asking, do we get 2 certificates for 2 specializations? So with a new program, what happens is that when you graduate, say you do the 2 specializations as part of the 72 credit point master's program, on your test review, the piece of paper that you get at the time of graduation, we will list the specializations that you studied in and that you successfully completed. This is a little bit different to how we used to do in the past. We used to send people out a certificate of specialisation from the faculty or from the discipline, indicating that of the area of study that you did your studies in. With the new program, the Master of Medical Imaging Science, it's printed on the piece of paper you graduate. So it is on your, you are given the recognition in that way. Let's have a look. I just want to make sure, I just got an email from a colleague saying that the sound has gone. Can you just raise your hand just to indicate that you can still hear me clearly? I'm just looking for some show of hands. Fantastic. Maybe something's wrong with my colleague's colleague. Okay, so I'll get back to my questions. I should say my colleagues' speakers. Okay, so I'm just reading the next question here. Question from Josephine. She's just asking, does 12 months of postgraduate work experience a maximum of 24 credit points? I'm not sure what's meant by postgraduate work experience. I think you're talking about, of course, but after graduating from an undergraduate degree and you've been working for 12 months as a fully registered radiographer, nuclear medicine technologist, scientist, radiation therapist, and you produce your letter from your employer stating so you're accredited, you've got your registration situation, 12 months as being a fully registered radiography, you can apply for 24 credit points of recognition of prior learning. And that would shorten the by 24 credit points and allow you to do it 2 years part-time. Okay, I'm just going to move through these. I know that I'm getting close. I am at the end up quickly because I don't want to hold you up. I do want to get through the questions that are here. So the question is, how does this program help a radiographer? This is from Emmanuel. Thank you for your question. Help a radiographer who doesn't have much access to CT or MRI. So choose, I guess, other specializations you can do. Maybe come in and do the graduate diploma. Start doing some of your core units of study, doing your theory subject. And when you get the opportunity to work in that area, or if you want to use this as evidence that you're very keen to work in that area and you're employed and give you an opportunity to work in that area, then you could go on to do the application subjects like the CTA and the CTB and the MRA, B and C. But when you are doing those subjects, we do ask that you're working a minimum of 2 days a week. We prefer 5 days a week, but a minimum in that area performing those procedures so that you get the assessments and the requirements for the unit of study. So that's how I believe would help. It really does support those people who are working in those particular areas of specialisation. Thanks, Nicole, for letting me know that you found out about it from our events calendar. That's fantastic. We'll certainly will pursue that. Okay, so there's a question from Hal, and it's asked, how long do we have to enrol in the subjects? If you're already enrolled in the program and you want to think about the subjects that you're doing, I'm pretty confident. I don't have it in front of me as when the cut-off dates are, but because all of our learning materials are online and offered during via distance education, you know, you can enroll fairly quickly, but require permission. So my advice is to do your enrolments as soon as you can. You can alter your enrolments. They're insistent to change units of study, and you can pretty much do that, I think, within the first week of the semester. But once again, don't leave it too late. I'd hate you to fall back in your study. So there is a bit of time left, but the sooner I think the better. Okay, so exactly how many hours per week of study would you expect students to complete? is this at all, or is there online sessions that you must attend? This question. So, you know, different students are going to take different amounts of time, but roughly I'd be expecting for a 6 credit point in a study, you'd be commitment of about 12 hours per week. Also, there'll be times that you'll be doing to successfully transverse it through the program without causing yourself undue stress. That's the sort of commitment that you'd like to do. There are some times that you need to, a lot of things are asynchronous, so you don't need to be online for a particular like that, but they will be held, for example, at a certain time online, and they'll be, and we're in the process of implementing an invigilation process. You can still do it at home, but there'll be someone who comes online to help you with the setting up and performing that exam. So there will be things that will be done at certain times. Sometimes we have online tutorials, which could be like a webinar or a place that you can interact with tutors, but we'll try and let you know at the start of the semester when those things are, so you can plan your life around the semester to be able to participate in that. A couple of messages about being able to hear me. Okay. Just reading a question here. Okay, so just a question about applying into the graduate certificate first, and are we able to apply for non-specific credit later after a year of study? Yes, you can. So it's very flexible, but if you want to drop me an email or give me a phone call, I'm happy to talk to you about your enrollment options just to make sure that you don't fall into any traps. That's probably the best way to manage it. Okay, I'm just reading my next question. Okay, someone is asking, how do I actually go about applying for credit? So it's asking, what is the process? So you can apply for credit at the time of putting your application in, or you can apply for it later on in the program. So it's really up to you. You don't need to put it at the time of application. In some ways, it may make life a little easier if you apply for it later on, that recognition of prior learning, because that way they can process your application, and then you can later on go into Sydney Student and put in your application for the recognition of prior learning or specific credit. So you can go both ways, but we're getting close to the start of the semester, so maybe applying for credit as not part of your application, because we can't process your application until we've finished the credit application process as well. So binding them together can slow things down at times. So someone's asking, how do we go about seeing the recorded webinar? So what we'll do later on is that we'll send out an email to all the people who've registered for this particular webinar, and in that they'll contain a video link of that webinar, and you'll be able to view that. So I'm getting to the end of my questions, and I will wrap up in just a minute. Thank you for your patience on that. Program offer any course in medical sonography? No, not at the moment. Course at the moment. So unfortunately the answer is no. We may do something there in the future, but I can't make any promises immediately planning for at this stage. Okay, I have made it to the end of my list, and you have been patient and made it to the end of this presentation. Thank you for everyone who came along and participated. Remember, you can contact the faculty if you have any further questions. They can forward those on to me. I have talked about my email address, so if you have a very specific question about your enrollment that you want to run by me, you can also do that as well. Just remember that this is a fully distance program, so most of the learning occurs online. All the learning materials are online. We're not posting out learning materials to you. Lecturers are often recording video lectures of their presentations. They're providing you with readings, providing you with questions to test your knowledge as you're moving along. We have a variety of assessments that are online as well. There could be exams, there could be quizzes, and there'll be essays and assignments. So I'm pretty excited about how we put together this program. I think it makes the best of the current learning pedagogy and is a great way for people who are working and wanting to study to achieve that in their own time space. So I will say good night and thank you again for your attention. Please remember applications close at the end of the month, and there's lots of people you can talk to if you want further information, and we'll be sending you a link to this video probably within the next week so that you can review that at that time. So thanks again and good night.